Hi everyone, I Smati Christopher, Triple M College of Nursing Faculty, Child Health Nursing Department, Chennai. Today's class, I would like to discuss about the Neonatal Intensive Care Unit. Neonatal Intensive Care Unit, called as NICU, is a very specialized unit where critically ill neonates are cared to reduce the neonatal morbidity and mortality. Admission to NICU is mostly from the labor wards, operation theatre, and anywhere from the hospital or any other reference centers. Indications for admission into NICU: neonate who need resuscitation and treatment to monitor the vital parameters to prevent complications, for the pre and post operative management, for any sick infant who needs care for the purpose of procedures, investigations, and for the treatment. Purpose of NICU care: mainly to reduce the neonatal mortality, to improve the quality of life among the survivors, to prevent infection, to control visitors, for the counseling to the parents or the caregiver, care of abandoned babies. SGNU, Special Care Newborn Unit, it is part of NICU, mainly for the purpose of provide care at birth, including resuscitation of asphyxiated newborns, management of sick newborns, referral and transport services, postnatal care and immunization services, follow-up of the high-risk newborns. NICU setup. Initial planning. The initial planning start with the coordination with different departments, place selection, plan of budget, manpower, materials, methods to practice. Then deciding the bed strength for the 3 levels of NICU care. Space between each bed will be planned about 125 to 150 square feet. Separate isolation rooms with the space of 100 to 125 square feet. Area for the breastfeeding, expression of breast milk, area for preparation of IV fluids, total parental nutrition, and medications in aseptic manner will be planned. Apart from that, the storage areas and etc. will be planned. Location of NICU. NIC to be located as close as possible to labor room and OB/GYN operation theatre to facilitate prompt transfer. It should be near to the elevator for the easy transport. Feasibility to sunlight, mainly ultraviolet rays, to augment asepsis. Next, we'll discuss about the nursery design. Single corridor, a split unit on either side of the corridor, mainly for the purpose to avoid easy mobility. There should be a minimal working distance. Constant surveillance should be monitored. Adequate lighting, especially 150 foot candles for the purpose of procedures, 20-foot candles as overhead light. Ventilation, there should be a proper facility for the exhaust and laminar flow. Temperature and humidity, it should be between 26 to 28 degrees Celsius. Radiant warmer infrared lights and bulbs are used to maintain the temperature. Acoustic characteristics, the sound uh, decibel should be between 45 to 75 decibels as per International Noise Council recommendations. Mainly the noise prevention is to protect from hearing loss, to prevent increased ICP, intraventricular hemorrhage, physiological or behavioral disturbance. Electrical outlet in NICU. There should be a facility for uninterrupted power supply with backup power sources such as auto mode inverter. Adequate number of 8 to 12 points at the height of 4 to 5 feet, 5 to 15 amps extra points should be facilitated in the NICU. Baby care area. Nurses station or central station should be there for monitoring the works. Areas and rooms to be planned for intramural babies or inborn babies, extramural babies or outborn area. Examination area should be there. Mother's area, nurse station, 2 layers of glass pans for isolation, hand washing area, governing area, clean and dirty utility area, storerooms, especially for general items, equipments, linen, counseling room, conference room, staff room, changing room should be there. Infection control in NICU. To prevent hospital acquired infection, universal precaution to be followed. PPE, that is personal protective equipments, hand hygiene needs to be practiced. Scrub and rub to be followed according to the protocol. Aseptic technique in all invasive procedures to be practiced. Prophylactic antibiotic as per physician order. Cleaning and mopping should be carried out in each shift with 3% phenol or 5% Lysol or based on the organization policy. Biomedical waste management, spill management, walls, window and furniture cleaning to be followed periodically. Clean and dirty utility area to be separated. Soil linen management, pest control, sterilization protocol to be followed. Disinfection protocol in an ICU. The fetal forceps to be sterilized every 24 hours once before using. But as per organizational policy, we can follow. But according to NABH, the fetal forceps are not allowed to be used in the NICU area. Oxygen tubings, change of water and humidifier chamber to be changed every 24 hours once. Ambu bag to be cleaned with consoler or Sidex or ETO to be used to sterilize it. Ventilator circuit tubing to be changed every 24 hours once. Open care system, especially the incubators and monitors to be cleaned with 2% basiloid solution. To follow lines and tubings, changing protocol to be followed. Anti-room hand wash area. This is before entering into the NICU. There is a facility to perform hand hygiene. In that area, uninterrupted water supply to be ensured. Hand-free elbow handle or foot control tab to be there. Sink should be with the measurement of 24 into 16 inch from back, 10 inch deep, made of porcelain or stainless steel. There should be a pictorial instruction to use PPE and hand wash. The wall adjacent to the sink should be non-porous in nature. In ICU, preferably a medication room or a separate area with laminar flow facility should be there to prepare IV fluids, total parenteral nutrition and infusions, and to load some of the medication for the purpose of infection control. NICU equipment. Some of the NICU equipments are crash cart, CPR tray, ABG analyzer, infusion pumps, syringe pumps, ECG machine, non-invasive ventilators, glucometer, defibrillator, phototherapy unit, pulse oximeter, deep freeze facility, warmer, incubator, dialyzer, multi-channel automated monitor, NIBP, high frequency ventilator. Documentation in NICU. The unit should have a printed problem-oriented stationery for maintaining records, admissions, transfers, referral, and discharge slips. Records of all admissions should be maintained in a register or on a computer. The information should be analyzed and discussed at least once a month to improve the effectiveness of NICU in providing the services. Nowadays, the EMR, that is the electronic medical recording, are used to store the data. Education program at NICU. There should be continuing medical education programs for physicians and nurses in the form of lectures, demonstrations, and group discussions. This should cover the important issues like resuscitation, infection control, sterilization, and other procedures. Care of critically ill babies, inserting arterial or venous catheters, exchange transfusion, care of ventilators, intubation, ABG blood collection and interpretation, and some other procedures can be taught through hands-on skills. All NICU team should be encouraged to participate in research work, mainly to improve the quality in NICU. Now we will see about the measures to prevent infection. First step in preventing infection is hand hygiene practices. In hand hygiene practices, we should always keep in our mind about the 5 moments of hand hygiene as well as the steps to be followed during the hand hygiene practices. Next is use of PPE. Personal protective equipment should be used according to the baby's condition as well as according to the procedure. Next is surveillance. Surveillance is the microorganism statistics that we have to take it by doing a culture. So the culture should be taken from the NICU ceiling, walls, floor, from all equipments whatever we are using it for the babies, AC vent, lights, water source, and from the patient care unit. So this will give us the information about the microorganism growth. So this will give us the safe practicing of NICU care. Next is about the environmental hygiene. Periodical the cleaning should be done in NICU. 3 to 4 times we are supposed to clean the patient care area, and the instruments and the equipment should be cleaned according to the protocol and as well as by the recommendation from the manufacturers. Next is the isolation technique. So we have to follow the isolation technique for intramural and extramural babies. That is, inborn babies, we are monitoring the baby, so we'll ensure about the infection control. But extramural, we don't know how the baby during the birth was handled, so we have to take extra precaution to prevent cross infection to other babies. The next preventive measure is Awareness and training programs. In awareness and training program, we are supposed to focus to educate the employees, those who are working in NICU, with hands-on skills and with mock drills. Next step in this is safety of the staff. Always we have to ensure the safety of the staff, those who are working in NICU, by providing necessary equipments, whatever it is needed for the care, and the PPE should be adequately provided to them, as well as the duty schedule should be feasible for them to work. Next is caring for the community. In that we have to give proper education and proper counseling to the caregivers, especially the parents. Next is quality improvement. In quality improvement, we have to ensure to focus for the continual improvement of the care. Next step in it is proper disposal of waste. The biomedical waste should be segregated and it should be discarded according to the protocol and the recommendation from the government. The final steps in preventive measures are antimicrobial management program and audit. In antimicrobial management program, the infection control officer should recommend the basic antimicrobial list, and according to that protocol, as a prophylaxis, we are supposed to use it in NICU. Then last one is audits. Periodical audit should be done. So we have to see where is the lack and we have to focus to improve the quality. Cleaning procedure for isolation bed. Do not shake the linen. Soak in 1% sodium hydrochloride for 30 minutes and send to laundry. All the articles, especially IV stands, furnitures, should be cleaned with 7% Lysol. Clean the walls and bathrooms thoroughly with detergent and disinfect with 7% Lysol. Eco Shield. Eco Shield is the solution used for fumigation for the purpose of disinfection. It's a fumigation and surface disinfect by deep cleaning. The composition of Eco Shield is hydrogen peroxide and dilute silver nitrate solution with the ratio of 200 ml of Eco Shield in 800 ml of water to be diluted, and it should be used for deep cleaning purpose or for the fumigation. The contact time is 60 minutes. Role of a nurse in NICU. Ensure effective ventilation and oxygen therapy. Ensure optimal environmental temperature and the neonate temperature. Adequate nutrition to be monitored. Acid-base balance to be ensured. Normal blood pressure and hematocrit levels to be monitored. Fluid and electrolyte balance to be maintained. Intake output should be monitored. Weight and neurological status assessment should be carried out periodically. Medication preparation and administration should be done. Hygiene and control of infections to be carried out. Participate in research work. For NICU related references, you all can refer Megaban Singh, Wong's Essential and Goy's Essential. Thank you. See you in the next class.